I'm Tom Strafacci with Functional Fitness, and this is just a basic primer regarding our use of the Russian kettlebell and how we use it for people with low back issues, low back pain, chronic low back weakness, even some post-operative low back people. Once the physical therapy patient has progressed past his basic Watkins-type protocol exercises of quadruped and dead bug type maneuvers in the supine and prone positions, and then we progress them into planks. Then when we want them to do something a little more dynamic, more active, one of our first tools of choice is the Russian kettlebell. The Russian kettlebell is basically a cannonball with a handle on it. And this device, is primitive as it looks, has been used for the last 1,000 years in the East. The Russians have made this very popular lately, bringing it to our exercise specialists here in the United States. So there are countless exercises that can be done with the Russian kettlebell, but the ones I prefer to use are the three most basic ones, and they are specifically designed to maintain the neutral spinal position, to activate the weak and sometimes amnesic gluteal muscles, and to strengthen the overall core musculature and give the client a firmer proprioceptive feel, if you will, of movement under load. The first kettlebell movement that I like to instruct people once their low back pain is stable is the basic deadlift. Now the kettlebell deadlift is basically, we instruct the client to keep his back flat and long, keep his head in the neutral position, stick his tail out, squat down, grab the kettlebell with both hands, and stand up. You can see this exercise is aimed at the basic squatting movement, and we're emphasizing here gluteal contraction in the standing position. This is almost a plank position. Eyes up. Boom. That's the kettlebell deadlift. We use very moderate weights. We don't have the client try to determine what their maximum weight is on this kettlebell deadlift. We simply do it for volume, to instruct the client or patient in proper body mechanics and lifting from the ground, and again to strengthen the hamstrings and gluteal posterior complex. Once the client's comfortable doing that, it might take 2 workouts, it might take 2 weeks. But once they're comfortable doing that and they're pain-free, we progress into the kettlebell swing. The kettlebell swing is simply a way of totally isolating and activating the hip extensors. Most low back patients we've found have very weak gluteal muscles from prolonged sitting or inactivity. The hip extension motion that's accentuated with the kettlebell swing helps wake up these gluteal muscles, helps activate the hamstrings, and at the same time teaches the client to maintain a long spine. Here's the kettlebell swing. We use very light weights, and again, focusing on flexing the hips and extending them with no back rounding. Now once the client has mastered the kettlebell deadlift and the kettlebell swing, what we like to teach them then is a modification of the kettlebell swing, and we ask them to do a one-handed swing. Doing a one-handed kettlebell swing brings some rotational component into the hip extension. And it kind of mimics a lot of activities that are done in real life. Rotating to get in and out of a car. Perhaps rotating behind you as you walk and live real life. So basically, what we do with the kettlebell is that we try to mimic motions and activities that are performed naturally throughout the day, stressing proper body mechanics. It's an inexpensive tool. Some of our clients have even opted to buy their own kettlebell and go beyond these basic body mechanic type exercises. If you have any questions, feel free to call, and thanks very much.